Are you?
Am I audible? Hmm? Okay. I think I'll wait for a few more minutes, just maybe a minute or two for the people to join in. I think it's a minute past 5, and we can start maybe 2 or 3 minutes past 5 so that people can just join in. So it's a weekend, and I hope all of you are having a good time at home. Tomorrow is a Sunday, and all of you can rest. So I'll be completing my talk really soon this time, just maybe 20 minutes of theory related to breast cancer. But rest, I would like people to ask questions so that I can answer them. And I think that would be a better interaction. You can just post it on the comments, and I will try to answer them. I will wrap up the entire session maybe within 30 to 40 minutes. So, I think I'll start the session. So this is the month of October, and October is known as the Breast Cancer Awareness Month. And I think most of you have heard someone in the family with family or friends with breast cancer, and there is so much of awareness going on about cancer and celebrities having cancer. Most of you are very aware of your body. I've seen people being very health conscious. People keep asking me, are there ways to avoid cancer of any sort? So we have started this breast cancer initiative, breast cancer awareness. It is more for the people who do not know me, so that they know me, and because the people who know me, they know where to go when they have questions related to cancer. So also this breast cancer awareness, this cancer awareness drive is for most of my friends and family. We are all at an age where we are growing older, and with age, I think the chances of cancer it increases. So this month we have my initiative is to start the breast cancer awareness, because this is the breast cancer awareness month, and it's for all my lady friends out there. So I think starting with the anatomy of the breast, because the breast anatomy is important, not just to explain about breast cancer, but other conditions of cancer as well. So the breast has basically two components. The two components are basically the lactation glands. The lactation glands in the breast are around 15 to 20. So I'm just going to show you a simple figure. I hope you can see it. So these are the lactation glands where the milk is produced. So these lactation glands will be around 15 to 20, and the lactation glands will be surrounded by fat, which is the stroma. The stroma is supporting the lobular glands. So now why this anatomy is important is, in a female, there is a hormonal cycle. The hormonal cycle has 2 or 3 different kinds of hormones. So the first 4 days, if we consider, is as the bleeding period. The bleeding period is followed by a small surge in the estrogen level, which is a hormone. Now the estrogen level that starts to increase, what it basically does is it prepares the uterus for pregnancy, and it is preparing the breast for lactation. Lactation is to produce milk. Now, when the estrogen level starts to rise, the lactation glands, they increase in size. The supporting glands, which is the fat, that also increases in size. As the 14th day approaches, ovary releases the egg. There is a surge in the hormone, which is the luteinizing hormone, which causes the release in the ova. After that, the uterus is waiting for the conception. It waits for 4 to 5 days. If the conception doesn't happen, the bleeding happens. Similarly, the breast, the lactation glands, and the fat, they start increasing in size. Once the conception doesn't happen, what happens is the breast lactation glands and the fat starts to decrease in size. So this is a continuous cycle. Now, why I have mentioned about the cycle are for two reasons. One, a lot of breast pain that ladies generally have. They come to the OPD thinking that they've got breast cancer simply because they have breast pain. This is simply because of the hormonal levels that might increase with respect to the increase in the number of glands, the size of the glands, or the fat. So the hormones might increase, the size of the fat or the size of the gland may or may not increase. So there's a disproportion in the size of the gland and the size of the fat. So the size of the gland might increase, but the fat that is supporting the gland may not increase. So what happens is you might feel some kind of lump when you are having pain in the breast. So what happens is when there is this lumpy feeling in the breast, one tends to feel that you're having some kind of cancer or there's some swelling which is not, which is quite abnormal, and you come to me as a patient. So what I would like to say is, if you're trying to regularize the hormones, this kind of pain in the breast, swellings, lumps in the breast may not be a possibility in you. So one tends to go through these sonographies, ultrasonography, or a mammogram, and they would probably diagnose you with cysts in the breast or small swellings in the breast. Let me tell you that these cysts and these small swellings, which could be fibroadenomas or just simple cysts, they do not give rise to cancer. They are not malignant, which means that even if they remain in your breast for a long time, they have a small tendency to turn into cancer. So this is the general cycle. If you have been to my previous video, I have also mentioned that the body follows the endocrine axis. Now, the endocrine axis means hormones are produced from the brain. It involves the breast, the uterus, and the adrenal glands. So the breast and the uterus are connected. We need to regularize the hormonal cycle. If the hormonal cycles are not regularized, we tend to get what is called as cysts in the breast. Cysts or fibroadenomas, they are just simple benign swellings, nothing to worry. Even if you have them, you don't need to get it operated. As a doctor, what I see is the size of those swellings. If the size of the swelling is anything more than 3 to 4 centimeters, if it is aesthetically not pleasing or if it is causing pain, only then we advise you to remove it. Otherwise, these cysts and these fibroadenomas are absolutely normal, nothing to worry about. Now, coming to addressing the elephant in the room, which is cancer. In the West, it is advised that we should undergo a mammo after the age of 50. It is advised by the Oncology Association, the American Oncology Association. In India, however, it is advisable for all the ladies to undergo a mammo and a USG after the age of 40, because it is a known fact that Indians tend to get breast cancer at an earlier age. Genetics could be a cause. Now, a common question that is generally asked is, what is a sono and what is a mammo? Now, when you take an X-ray of the breast, a mammo of the breast, I have mentioned that breast has two components, the lactation glands and the fat. The lactation glands on an X-ray, which is just black and white, the lactation glands will be white in color, fat will be black in color. The lactation glands in a premenopausal woman are much bigger. The fat component is smaller. Cancer is white in color. White and white will not be seen. Hence, we advise people to get a sonography of the breast. A mammo is generally advised after menopause because the lactation glands, they shrink in size. The breast is replaced by fat. So small amount of white material, large amount of black material, cancer will be seen as white. So a mammo is generally advised postmenopausal. Generally, we tend to combine both, which is sono and mammo together. So like I said, screening in India is generally advised after the age of 40. All ladies have to undergo screening and mammo. People who are generally premenopausal, we advise them a sonology of the breast. And after menopause, we advise a mammo of the breast. The recommendation is to get it done every year. There was a certain study which said that mammo could be harmful in terms of radiation or pressing the tumor, but those studies are unproven. One mammo a year doesn't cause any kind of radiation. So please go and get your mammo done. The reason why we advise you to do a mammo is if you get done a mammo earlier, it doesn't prevent the cancer, but it picks up the cancer at a very early stage. So at a very early stage, 100% cure is guaranteed. Number one. Number two, early stage cancers, very small ones, less than 1 centimeter, less than 0.5 centimeters, you might even avoid chemotherapy. Just with a simple surgery which lasts for not more than half an hour, you'll be cured of cancer. So hence mammo is very, very important. Like I said, mammo sono, which is a part of screening programs, cannot prevent cancer. It can only detect cancer at an early stage. What are the causes of breast cancer? Most causes of breast cancer are unknown. Like in my previous video, I've already mentioned, breast cancer is basically because of the surge in hormones. People who do not get married, lesser number of children, nulliparity that is. These have been thought of causing breast cancer, but there is no such reason. These are all hypotheses or postulates. We assume because the number of cancers have risen, this could be one of the causes. My own grandmother had 8 children, but she still had breast cancer. So it's not necessary that if you do not have children or you have lesser children, that your chances of getting cancer are high. The other causes of cancer, like I said, is if mother is having cancer, sister is having cancer, the chances that you might have a certain genetic mutation is high. So you need to go to a physician to ask them whether you need to get it genetically tested. Breast cancer and ovarian cancer comes in a certain complex. So we call it the breast ovarian complex. So you can have breast cancer in the family or ovarian cancer in the family. You still might have the chances of developing either one of them because both of them are part of the endocrine axis. So these are some of the causes. Other causes believed were deodorants, because deodorants are generally applied in the armpits, and the location of the tumor is generally in the upper outer quadrant of the breast. So it was believed that it could be deodorants, but that's not true. The bra or the cloth that is used for the bra was proposed. Again, that isn't true. Something that you eat, some toxin, non-vegetarian food, It's not true again. So the causes of breast cancer are unknown. I don't think people should run around reading some WhatsApp message, thinking that they could have breast cancer. Hormones are the only known causes of breast cancer. So causes of breast cancer, screening for breast cancer, that is how to detect early breast cancers. You cannot prevent the breast cancer. Breast cancer or cancer of any sort is generally because of age. I've already mentioned that before. It's generally as you grow older, chances of breast cancer can increase. In fact, once you reach the age of 70, the chances of breast cancer in a woman is 1 in 8. So that is the chances of breast cancer just increases with age. I know a lot of people are asking questions. I'll just get back to all the questions once I just finish the basics in breast cancer, and I'm only going to the questions again. So we are finished with the causes of breast cancer, which is mainly genetic, hormonal, nothing else. Second is prevention of early detection of breast cancer by screening, that is using a mammo or a sonomammo. Third is what's to be done once you detect breast cancer. So a breast cancer, once we see something on a mammo, we ask you to get a biopsy done or an FNAC done. We also do a complete checkup of the body to see if the cancer has spread anywhere. In our books, breast cancer is the best cancer. So why we say that breast cancer is the best cancer is because today, with all the science and all the medicines and all that we have, we assure all our patients, whatever stage they might come in, we generally assure them complete cure, if not cure, at least good control. So I think the fear of having breast cancer should be driven out. I have a very good example of a lady who works at my house. She's been having metastatic breast cancer, which is cancer that has spread to different parts of the body, including the bone and the pelvis. It's been, I think, 15 years, 10, 15 years. She's hale and hearty. So we are definitely able to control cancer that has spread. Once cancer is detected, patient generally undergoes the procedures of surgery, followed by chemo and sometimes radiation. Surgery, I feel surgery is the easiest part because it's half an hour. Patient is discharged the next day. It's just a matter of 1 or 2 days. Patient comes back after 15 days for removal of the sutures. Chemotherapy goes on for 6 months. Chemotherapy is only given for 3 to 4 hours, after which the patient is discharged. Patient can go home, and the patient is called back after 3 weeks. A lot of them get scared of chemotherapy in breast cancer, but let me tell you, breast cancer chemotherapy is one of the easiest chemotherapies. I generally don't see patients coming back with any kind of complication other than hair fall. They do not have vomiting or some kind of sickness. Some people can have, but it's one of the easiest kinds of chemos in all the chemotherapies that we have. And during chemotherapy, we also offer patients where they can put a machine inside their body. It only makes the chemotherapy much simpler, painless. We chemo cap where patients don't lose their hair. Hair lost will be back in a year's time. In fact, you start getting your hair after 6 months and they start to grow. I really wish I had my breast cancer patients here, and I'm sure there are a few listening to me as well. And they know what I'm talking about because a lot of them have got their hair back. So hair fall is the only main problem. Sometimes there is some discoloration of the skin, of the face, of the fingers. It's all reversible. It all comes back. Today, our main intention, our main goal is not saving life, which we know we anyways will. Our goal is quality of life, which means if a lady comes to me with breast cancer, my aim is to get her back to normal. She should be the way she is before she had the cancer. And that is our goal of treating a breast cancer patient. because it's one of the easiest cancers to be treated. Like I said, even stage 4 cancers can, if not cured, at least can be controlled. And I would like that message, I mean, if nothing else, at least that message to be drilled into your heads and to be given to the others around you, that breast cancers are good cancers. They can be cured. And early cancers is something that I guarantee to the patient, boss, you will be cured. Don't worry, you'll be absolutely fine. So I think I've ended this small session on breast cancer. I know a lot of you are having doubts. I can already see a few. If you have any more questions, if you see this video later, you can just put down the questions. I will try to answer them. There are a few questions that have been asked. I will just go from the beginning. Yes. So somebody has asked me, I am TNBC, will I get cured? So Madam has asked, TNBC, it's a very specific cancer. TNBC is triple negative breast cancer. Generally, when the biopsy is done, we test for three things: estrogen receptor, progesterone receptor, and HER2 receptor. This is very technical, so I'll just simply answer it. If all these three are negative, it's TNBC among is considered the worst in terms of its biology. Um, TNBC, but we consider TNBC from as a stage to stage prognosis. So if you are having TNBC, but if you come in stage 1 or stage 2, we still guarantee you complete cure. So don't worry about TNBC or ER/PR positive or HER2 positive. It depends on the stage of the cancer. I hope that answers my question. I wouldn't like to get too technical because there are other laymen in the group as well. Uh, Somebody has asked me, I've got my hysterectomy done. Does it need to undergo still screening? Madam, not related to this session, but yes, even if you undergo a hysterectomy, you need to get your pap smear done. Let me also tell you, if you have done your hysterectomy with your ovaries removed, it's protective for breast cancer because ovaries produce your hormones. And like I said, hormones can cause breast cancer. So if your hysterectomy is along with the removal of the ovaries, it's protective for breast cancer. Uh, Somebody has asked me, if do men get breast cancer too? Yes, men do get breast cancer, although not as common as in the woman. In fact, I have one patient with me right now who is male. He's a young male who's been diagnosed with breast cancer. It's generally seen in people who drink a lot, because when they drink a lot, their liver gets fatty. The liver is unable to function well, and it produces a lot of hormones, which includes estrogen, which is a hormone that is primarily produced in the women. But however, women produce it periodically in the first 14 days. But once the liver starts producing estrogen, then it's produced on a daily basis. I have forgotten one of the causes of breast cancer, obesity. Now, what happens is when you're obese, there are fat cells in your body. Fat cells tend to produce estrone. Estrone is converted to estradiol, converted to estrogen. These are forms of estrogen. Especially that happens in postmenopausal women when women tend to develop around the waist. It's not just about breast cancer. The fat around the waistline is also part of the metabolic syndrome. It can cause increase in cholesterol, heart diseases, heart ailments, diabetes, ovarian cancer, breast cancer. So hence we tend to emphasize on exercise. We tend to emphasize on diet modification, because the fat around the waistline dangerous fat, although they are called love. What are the symptoms that we should be aware of? That's a good question. I think most of you are aware that it will be some kind of a lump in the breast. So what I generally tend to tell people during an awareness session is one, self-breast examination. Now, self-breast examination, there is a certain way to do it. I will be putting it on my YouTube channel as well, but since it's a live session, I will show it to you. Use your 4 fingers. The breast will have 4 quadrants. Now, the 4 quadrants, you can divide your breast into 4 equal parts, including the central part, which will make it the 5th. With your 4 fingers, first thing to do is, while taking a bath, once a month, you need to do this. You need to move your fingers in all the 4 quadrants, 1, 2, in a circular fashion, 3, and 4. This is self-breast examination. 5th thing is to feel around the nipple areolar complex, and at the same time to pinch your nipple and to see if there's any kind of discharge. Breast cancer can cause some kind of reddish discharge, and you need to pinch your nipple and see if there is any kind of discharge. So 1, 2, 3, 4, and then pinching the nipple, in feeling the breast in a circular manner. This is first done while taking a bath, second in front of the mirror, and third while lying down. This is self-breast examination. This is done once a month. Second is clinical breast examination, which is done by a physician. In a female lady's case, you can go to a female physician. You can ask her to examine your breast because it will be an unbiased way. She's a doctor, she can do it. So the clinical breast examination is done once in 3 months. And what you do once in a year is, I have already mentioned, your mammo. So this will reduce your chance of getting a cancer in an advanced stage. So let me just remind you, keep it simple. Clinical breast examination while taking a bath, in front of the mirror while sleeping, once a month. Self-breast examination in the bathroom, in front of the mirror while sleeping, once a month. Clinical breast examination by a physician once in 3 months, and a mammo, which is done once in a month. The other symptoms could be a swelling over the collarbone. Sometimes in advanced cases, you have backache. You can have, if it is spread to the lungs, you can have cough. You advise hormonal therapy after menopause? A very good question. So these hormonal therapy after menopause, for people who don't know, hormonal therapy is generally done for a lot of things. For dry skin, it is done to lubricate the genital area. Hormonal therapy can also sometimes be used for psychiatric disturbances that you can have post-menopause. The hormonal therapy is given in very, very small doses. They can come in ointment form or they can come as a tablet form. If you are symptomatic for any of these symptoms that I have mentioned, the postmenopausal symptoms, some kind of irritability, dry vagina, dry skin, hot flushes, you should go in for hormonal therapy. But the hormonal therapy, it comes in very small doses. It's like taking your oral contraceptive pills. And that hormonal therapy has to be under the advice of a physician. Of course, once you start taking a hormonal therapy, you're nothing but a premenopausal woman at that time, absent the eggs that will be released from the ovary. But like I said, you need to undergo all the screening mechanisms. You need to continue undergoing the screening mechanisms like I have mentioned. Somebody has asked me, 3 months ago I got checked and was told benign. I think, madam, I think somebody is asking me that she got checked 3 months back and somebody told her it is nothing, and then 3 months later the cancer was metastatic. I think it's just a case in point. All don't undergo that thing, this. I mean, everybody is not as unfortunate as you are, but I'm sure if it was cancer, it would have been diagnosed. It is very unlikely that something in the mammo was cancer and it was told that it was benign. Very, very unlikely. If is radical surgery is the only modality of treatment. So I make it sure that if a lady is less than 65, she is very motivated, I encourage them to undergo a breast conservation surgery. We need not remove the entire breast. I think I've removed them in very few. I always encourage them to take breast conservation therapy, which is removing only a part of the cancer. Breast conservation surgery can also entail some kind of plastic reconstruction, which is generally removing skin from the back. Breast conservation surgery also includes restoring the nipple, restoring the areola. All this is possible. However, if it does happen that we have to remove the entire breast for whatever reason, we can still reconstruct the entire breast using your abdomen. It's a plastic reconstructive procedure. It's a long, albeit a long procedure, albeit expensive, but that is also something that we can offer. In the West, in India, plastic reconstructive, we have very good plastic reconstructive surgeons. You wouldn't believe it. In the West, it's very common to undergo radical surgeries, that is mastectomy, and they generally put implants or prostheses under your skin. But here in India, whatever I have seen, we go for this plastic reconstructive procedure, probably because these prostheses, implants, people are not very tuned to the idea of having some implant inside their body. But here in India, whatever I have seen, we use a lot of plastic reconstructive procedure. I myself do a lot of them, and I have a very good plastic surgery team. So radical surgery is not the norm. I would say it's rather an exception. After surgery and completion of chemotherapy, if PET scan reports are normal, is radiation necessary? I think this is a very technical question. See, radiation, chemotherapy, and surgery is part of the treatment. Just because, if surgery is done, 80% of the job is done. Chemotherapy takes care of 10 to 15%, and radiation takes care of 5 to 10%. So it's up to you whether you want to take that advantage of the 5 to 10% that you want to do. Generally, you will be cured, but it is always advisable that you continue that certain protocol that we have mentioned, because these are tried and tested methods which we have done for decades. We do not want to reinvent the wheel to find out, okay, if PET scan is normal, do you still want to take radiation? So radiation is a matter of, I think, half an hour. It goes on for 4 to 5 weeks, but I wouldn't advise you to not take radiation if it was indicated in the first place. So BIRAD 3 on USG. So somebody has asked me a very technical question on sonography. On when you do an ultrasonography of the breast or a mammo of the breast, we grade the findings as BIRAD 1, BIRAD 0, 0, 1, 2, 3, 4. So BIRAD 0 is not done properly, do it again. 1 means nothing is found. 2 means something is found, but it is benign. Benign means sada gaat jo hum bolte hain. It's a cyst or a fibroadenoma. BIRAD 3 is what you have asked. BIRAD 3 is most likely benign, which is 90% chance that it is benign or a, I would say a normal thing to do. But you do a follow-up after 6 months again. It might increase in size. There's a 5% chance that it might increase in size, so do it after 6 months. But mammo is generally done after 1 year. So BIRAD 3, do it after 6 months. Let's see if it is increasing in size. BIRAD 4 can be divided 4A, 4B, 4C. Definitely looks suspicious, not sure. BIRAD 5 is definite cancer. Okay. And BIRAD 6 is, you've already got me a biopsy and I'm still doing a mammo. So after surgery, after how many months should we do physical exercise? Good question. Should we do physical exercise after surgery? I advise physical exercise, if not physical exercise, but at least physiotherapy of the operated hand, of the operated side, the day after surgery. So Nothing wrong with going for a walk, nothing wrong in doing yoga. We had done a small study with, I think, around 100 patients. Yoga had definitely improved that quality of life. I definitely advocate parallel therapies like yoga, meditation, music therapy, good diet. So definitely go for your physical therapy. Yes, lifting weights on the same operated site, I wouldn't advise. Uh, uh, so somebody is here, was already a breast cancer patient, and she says, I'm doing yoga and pranayam and I'm really happy with it. Somebody has mentioned about, again, BIRAT 3 category. Yes, BIRAT 3, like I said, is you have to repeat it. You have to repeat the sono mammo after 6 months and maybe even a biopsy. So I think I have, like I said, I would keep this session for a matter of 30 to 40 minutes. And I think I've clocked 35 minutes now. I hope I've answered most of your questions. My team will be answering these questions. Even if you see this video a little later, or if some other question pops up in your mind, you can just put it down. My team will make it sure that we answer your questions. If you have anything more in any way that I can help you, we are trying to create a package here for screening, which includes screening the entire body for men and women, so that a cancer screening package can be made, which you can do just like a cardiac screening for your heart diseases or for diabetes, that you can do every year. So that will include your mammo, your pap smear, your sonography, stool for blood, urine for some cancer cells, your spit or your sputum for cancer cells, chest x-rays, tumor markers, all that will be included in this cancer screening package. And I will let you know about it in my next session. So thank you for being there, and thank you for giving your time on a Saturday evening. Thank you. Thanks a lot.